have beautifully highlighted the challenges and discussed the potential solutions as well. I would like to take 5 minutes of the panel's time when discussing few key challenges which I have observed in tertiary care centers like teaching medical colleges. Though many challenges have been discussed, I would like to summarize those in a very quick fashion. So the first challenge that I would like to discuss here is that the challenge is related to the implementation of the guidelines. But before implementation of the guidelines, as seniors have already pointed out, one should be aware of the guidelines first. So we have very concise, beautifully drafted guidelines given by National Vector-Borne Disease Control Program. But are we aware of these guidelines? Are we teaching it to the students? Are we teaching it to the healthcare workers like ASHAs, ANMs, and medical officers? Though there may be guidelines and proper knowledge dissemination, are those guidelines followed in real world scenario? If yes, how well it is followed? Do we have any monitoring and evaluation mechanism for it? If not, why it is not followed? What are the challenges in implementation of these guidelines? What are the solutions for addressing these challenges? So there are so many questions for which we need to look answer for. For example, this is a snapshot from the guideline which I have showed in the previous slide. It says that we should give chemoprophylaxis for pregnant women living in high-risk areas and chemoprophylaxis for travelers who are going to highly malarious areas. Are the healthcare workers aware of these guidelines? You may answer yes with a lot of confidence. But if I ask you the same question, are they putting it into practice? Then the level of confidence will go down. So this is a big challenge. Though we have wonderful guidelines, how well we are implementing it is a question, and this is a key challenge we have. You might ask me, Dr. Venkatesh, you said in the intro slide that you will discuss about the challenges in the tertiary care hospitals and medical colleges, but now you are talking about guidelines and implementation in the ground level. Does it have any relevance? Absolutely yes. If these guidelines are not properly followed by grassroots level workers like ASHAs, ANMs, and medical officers, then what will happen? We know that the majority of our country's population is in rural areas, and ASHAs are the common point of contact, and the most poorest of poor people go to the PHCs and health and wellness centers first. If the health and wellness centers in the grassroots are not aware of the guidelines and not implementing them properly, it leads to delayed diagnosis, and the patient will ultimately end up in medical colleges with cerebral malaria or some other kind of complication. I am currently doing my research on capacity evaluation of health and wellness centers and PHCs of Jayanabad district of Bihar. I visited a PHC yesterday for data collection, and the photo you're seeing, this is the sad state of the PHC. When not even basic infrastructure is proper in our country, how can we adequately give primary care? And I also noticed that last week when I went to a health and wellness center, I saw a locker. In that locker, there was a brand new box, fully sealed. And when I opened it, I was surprised to see box of malaria rapid diagnostic kits. Since the day of start of this health and wellness center, not even a single kit is used. Does it mean that there was never a case of fever in the history of that locality? No, I don't think so. We keep complaining of lack of resources, but we don't focus on appropriate usage of the available resources. Like this, when primary care is not given properly, patients end up lately at tertiary care centers with advanced diseases, which makes management of malaria a challenging one. The next thing I would like to discuss is about the challenges related to referral. This was the referral hospital for the PHC, which I have shown in the previous slide. Beautiful building, but the building has only one doctor, 2 to 3 staff nurse, one lab technician, one pharmacist. So again, here, lack of manpower. Early diagnosis and prompt treatment might be affected because of it. Even if the doctor is identifying the malaria symptoms promptly and giving basic treatment, referring the patient to higher centers like AIIMS or some medical colleges, when the patient lands up in medicine OPD, what will the patient have in his hand? We expect him to have such a well-drafted, beautiful medical referral letter like this. But consider the manpower, consider the patient load in that referral center and other factors. It would not be possible to receive such a well-drafted referral letter. Leave the word well-drafted. In many cases, we might not even get a referral letter. So how the consultant sitting at the medical college know the proper history of the patient? How was the patient confirmed? How was the patient confirmed for malaria? What was the technique used for confirming the malaria? What was the treatment given for the malaria? So these are the questions for which a consultant sitting in medical college would not have any answer. So these are the few key challenges with referrals, and this is a definite challenge in management of malaria in medical colleges. So discussing our next challenge, how many of us are filling this malaria reporting form after treating the patients of malaria? A better question to ask would be, how many of us have seen this form in the first place? Where can we get this form? We are more interested towards managing patients who are sitting in front of our eyes, and we don't care much about the bigger picture. In other words, our physicians are not used to see things with a public health point of view. Hence, we do not give enough importance to fill this malaria reporting form. And when we are not communicating this to the concerned authority, when the medical colleges or the tertiary care hospitals are not conveying this information, not reporting malaria cases to the concerned authorities, it will be a barrier to detect an outbreak and to take essential preventive and control strategies. When we people at medical college do not do it, thinking that we guys are busy and we do not have time, then ultimately the number of malaria cases in the community would rise, and more number of cases will eventually come back to us only, thus straining the already scarce healthcare resources. How well are the teaching hospitals prepared to handle these outbreaks? I leave this to yourself. Hence, we should train and motivate our interns, postgraduates, and faculties to report malaria in a timely fashion, and this task is a definite challenge. Have we seen any kind of, coming to the next challenge, have we seen this kind of any written protocol for the management of malaria displayed in the wards or ICUs or anywhere? Not everywhere. And how to manage if there is a case of malaria outbreak and your hospital is getting more and more of malaria cases? Not everybody of us knows. But ideally, written protocol should be made available wherever possible. And we generally have experienced consultants in medical colleges, like Dr. Anirban sir was discussing physician's perspective. So me talking about the in-depth about the management of patient in medical colleges won't make great sense at this point of time. So let the consultants with their expertise, with whatever degree they have, whatever experience they have, let them treat the patient. Let them diagnose the patient, let them treat the patient, let them prevent the complication, let them help the patient recover and send the patient home. But what next? What is going to happen next? Do we have any mechanisms to follow up these patients? Do we have any mechanism to track these patients? Like Dr. Kaushik sir was saying in his presentation, do we have any beautiful dashboards to show us the status of malaria? In my limited experience of working with a few institutes, I have not seen such things put into practice. What to do if a patient develops some complications post discharge? What if he has a relapse? What if his family members develop or his neighbors develop? So we don't know answer for all these because we do not have a mechanism, a robust mechanism to follow up the patients. So this challenge has to be promptly addressed. We should devise standard mechanisms for following up malaria patients, and that SOP is to be put into day-to-day practice. We have primary healthcare centers, and secondary healthcare centers to treat the patients of malaria. We have research institutes like ICMR to do research on malaria. But both these can happen together only at medical colleges. But despite that, we could not see much emphasis as being given to research. In better terms, the significance of research is not felt by us as residents, as interns, as postgraduates. Okay, we focus either on clinics or we focus on academics. We tend to miss out that there is a component called research. Essential steps should be taken to promote research in the medical colleges. One such example is ICMR, STS, and ICMR MDM thesis grant given by the Indian Council of Medical Research. I was lucky to receive this thesis grant to be one among 50 in the country. But in a country like India, where there are several hundred medical colleges, giving these 50 grants, giving grants for 50 researchers, 50 PG students, do you think it is sufficient? So like this, more research in medical colleges, especially in important areas like malaria. This will include good diagnostic facility and the potential to carry out hundreds of research projects every year. So these are the few challenges I have observed in my limited experience. I would request the panelists to add on if if I have missed out anything else. Thank you so much.
Thank you so much, Dr. Venkatesh. As probably the only person who's not really a doctor on this panel, I'm actually stunned and amazed at the candidness of the thoughts that were being presented here. This kind of and by the way, I'm from Bihar, Gaya, Jahanabad. So believe me, I can assure you there are worse off cases. You had bricks and walls and doors there. So yeah, sorry to be, presenting the other extreme. But having said that, we are actually at a cusp where we have this lofty target in front of us that by 2027, the Honorable Prime Minister, and thank you, Harsh, for repeating it 3 times. I don't know, that was a wonderfully orchestrated move from your side and really, struck us deep. And that's something that, all of us have to be really looking forward to. And this repeated echo of all hands on the deck. So whether it's the medical colleges or the private practitioners, and thank you, I'll repeat Dr. Venkatesh and Dr. Narinba, and the way the candidness of you, in terms of how and why the health system is kind of missing out in terms of prioritizing malaria within your own ranks, and what needs to be done differently. Is absolutely, it's kind of staring on our face, but we're not able to put it together. And I sincerely hope with, the likes of Dr. Kaushik, Dr. Gopal, Dr. Tandon, Harsh, and others, we really managed to emphasize this in the new strategic plan that is being drafted as we speak. And this particular World Malaria Day, the 125th, which itself is a significant milestone, if you look at it, really should be telling how India needs to fight this elimination battle. And we are capable, and we have done it for smallpox, polio. I mean, there's a host of diseases that were far more complicated that we won over. This is possible. This is possible within a lifetime, within a short span of time. And that's something Malaria No More always aspires to do. And I guess, the panelists coming together, I'm sure, Clarnet and Dr. Kaushik will do a good job in assimilating some of the thoughts that have come in together. So thank you so much for your time. Thank you for arousing people like me who are not doctors and who continue to learn from people like you as to what needs to be done differently. There's a whole bunch of questions that have just been sent by Dr. Venkatesh right now. I think we'll have to find a way to, address these questions at a later date. And I'm sure the panelists would be happy to address if they have been directed to particular people as much. And let this be a beginning of a, conversation where we all come together passionately to achieve that one big goal, that what needs to be done by a country like India to eliminate by 2027. So even if it does not really happen, what can be done to set the systems right? Most of us have answers. Most of us believe that it can be done. And all of us have given enough pointers as to what needs to be done differently. And with the political commitment shaping up at the highest level, I see no reason why India cannot really transcend that Rubicon. With these words, let me end this conversation here. Thank you so much for your time. It was a pleasure having all of you here with lovely, candid thoughts. Please continue the conversation with exactly this candidness, whoever you speak to. Believe me, because there is still a lot of resistance to what Kaushik kept referring to. The old school is not yielding as much. And we are still resistant to new ideas. And that's where we all come in. We need to push that agenda hard, because the new order will not accept what worked earlier on and will definitely not work in the future, as APJ Abdul Kalam managed to say a long time ago for all of us. Thank you so much for your time. Thank you so much for your wisdom. We'll all be learning and we'll all be doing better. Jai Hind.